Yes, yes. I just wanted to make sure that the two talks are recorded
Separate.
separately.
Okay,
That's
okay,
it.
got it. So red light therapy is known by photobiomodulation, low level light therapy. So different names are there for the same principle, I can say. And there are a lot of papers available online. You can just go in PubMed and type red light therapy. You will get a lot of research papers. So what we are talking about is 400 to 700 nanometers of visual spectrum, and that is when you come to near 700 microns, where you get that infrared light. See, the human body needs the whole spectrum from blue to red for the overall growth and well-being of the human body. If anything in excess will have its own problems. So naturally, emmetropization happens when red light focuses in front and green focuses behind and yellow on the. I'm just talking in layman's language actually. It is an electromagnetic stimulus. Actually, we still have to study, and not many people know what is happening, but this is a generalized thing. Even when you do a refraction, we do the red and green test to make sure that your correction is correct. So red inside and blue or green behind the retina, yellow falling on the fovea. And this is what the best correction. Unfortunately, for children, when because they are doing a lot of near work because of the high demand of the studies and all, and that is causing when you bring any object closer, the image shell forms creates a hyperopic defocus at the peripheral retina, and peripheral retina is responsible for the growth of the eye, as I explained in my first talk, and that is what is causing more and more stimulus apart from daylight exposure, red light, vitamin D, and other stuff. Now talking about red light therapy is not new. Some of you must have recognized this lamp, came by Philips. They used to promote this for pain, rheumatic pain, backache pain, or muscle injury. It is still available in the market. You can go online and Amazon, you will get it. So it is not new. Red light has been used. Even I think nowadays there is some advertise going on about some patch or a small disc-like thing. Again, same red light therapy, but that is used for a blood circulation, skin infections, anti-aging, wound healing, natural pain relief. So a lot of properties. Of course, depending on what wavelength you are using, most of the dermatologists are well versed with this. There are a lot of instruments and equipments available in the market, which usually use near infrared light, that is 850, which is little bit hot, and 660 is not that hot, and it is visible light actually. So, depending on what intentions you have, you can use different wavelengths. There are some, this kind of whole body treatment modules available in the US. So you can go like a hyperbaric oxygen therapy. You can have a full body red light therapy. You can go inside the system, sit for 10-15 minutes, and you get that effect of anti-aging or skin healing or whatever you call it. There are different patches also available. Now, this is the device which is available in the China, which is all these studies that you talk about is this type of device they are using. Unfortunately, this is a laser therapy device. Okay, so recently there are a lot of restrictions imposed by the Chinese health authorities, and they are almost controlled that nobody, you just can't give this device and do the red light therapy, because they have seen there are a lot of negative effects. It is like some of our colleagues from Canada says you are barbecuing the eyes because it is actually meant for only 3 minutes. But people think that it is, if you use more, it will give more effect or better effect, and that is where the danger lies. So you have to be very careful about the red light therapy, what you're talking about. But yes, it does work, and there are different ways and means to do the or get the same effect. As I said, there are a lot of other equipments available in the market for different reasons, and they are popular. They are being used by a lot of practitioners, and especially for the dermatology. Again, I'm saying it is for dermatology. And of course, there is a little bit crossover for the vision therapy or myopia control also. So red light is now there since long, and now it is being used, more and more because it is showing good results. In our ancient tradition, we do this morning sun, look at the sun for, but you're not supposed to look directly to the sun. You have to close your eyelids and then look. But most of people, try to look directly and then you get up problems and retinal issues will happen. So just be careful, close your eyes and look at the sun. Uh, so as I said, it has a lot of energy. So it is measured in photon energy, not the power. So electron volt is controlled and applied to the eyes or skin. And what happens actually is it stimulates the mitochondria, which has a receptors for photon energy, and it creates a ATP, that is an energy molecule that we know, and that is used for whole body functions. And now it is known that if there is a excess of red light or more stimulus is given to the mitochondria, and the mitosis happens, and more mitochondria starts producing. So mitochondria cannot produce on its own, so it will have a cell along with that, and that is how the new cell forms, and you get a rejuvenation, or the skin becomes younger or looks younger. So that is how it is being used. And there are papers for diabetic retinopathy, macular degenerations, a lot of studies going on using the red light therapy. It is proven that red light therapy reduces the drusen and it improves the sensitivity. That means when you work for a long time in the sunlight, your rods and cones becomes a little bit bleach. If you, especially when you enter in the cinema theater in a dark room, some people will get acclimatized easily or faster. Some people will take more time depending on how much UV light exposure they had. So if you use the red glasses, then you will get adapted very easily. So stimulus is much faster. Diabetic retinopathy and low level red light therapy, as I said, is used for dry eyes also. So different applications. Some people have used for collagen. We use a simple hot fermentation, which is about close to that only. You are trying to give little heat. So heat, when you exceed into that 700 microns, so heat is produced. That is a visual red light or invisible red light. So myopia, people have actually used this and proven that it, no doubt, it definitely controls the actual elongation. I'll just skip this. So what happens is red light therapy penetrates through the epidermis and dermis and reaches till hypodermis, and that is how it works. You can use a simple red light glass and still you will get about a similar effect if you are in a sunlight, because it will cut off the rest of the other wavelengths and only allow red light to penetrate, which is more safe because you are not increasing the intensity. It is a natural. The human body is designed to accept the daylight and you will not cause any problems. So this is the most safest. Of course, it looks a little odd, but if you want to use as a therapy, the child can use it for 2-3 hours when they are in the sunlight. Of course, you have to make sure the nutrition is correct, sleep is proper, exercise, breathing, and light exposure is correct. There is one particular research scientist in UK who has a lot of papers, and they use a simple red LED torch and proven that it works in myopia control or axial length elongation control. Just 3 minutes, 3 times a week, and it works. So brain gets stimulated by this red light, and using that stimulus therapy, there is a new branch of vision treatment called syntonics. So it works on a parasympathetic and sympathetic nerves and causes the effects. So different glasses are used, basically red, green, and blue for different situations. I do this tinting on a scleral lenses for different application like a headache, um, dyslexia, post-traumatic brain injury, migraines. So it works definitely in real life. So you can use the different filters. But as I said, when you're using filters, you're not increasing the intensity. Whatever is natural light is there that you are using to your advantage. So you can use these different lights or tinted glasses. And there is a lot of research going on and new things will come up. This is well known factor that in vision therapy, red is used to treat the amblyopia. The amblyopic eye will have the red filter and the normal eye will have the blue filter because red light will stimulate. And again, this is the same principle. When you have a red light, the brain will think that, hey, you don't have to elongate further, and it will control the actual elongation. So again, as I said, this is my little bit of contribution. We have the defocus glasses. Then I know, okay, red light is helping, so I added with the red light also. And still, there is a lot of data which is coming up. Research is going on, animal studies as well as human studies. Once they are appropriate, we'll publish the data. Um, so basically, multifocal lenses, orthokeratology, atropine, and spectacle and contact lenses, and of course, lifestyle change can be used to have the myopia control. So, red light therapy basically increases the choroidal thickness. This is proven by the research papers, enhances retinal blood flow, modulation of growth factors, and reduces oxidative stress and thickens the sclera also. So increased choroidal thickness, if you measure the myopic eyes, you will find the difference. And after the treatment, you will see the choroidal thickness is increased. In fact, this happens with ortho-K, this happens with other optical stimulus also. So scleral, understand this, and then you can apply the treatment. And basically, the idea is to reduce the eyeball elongation. So light exposure, if you use correctly, again saying don't use the laser therapy lights. They are really going to have some problems if not used properly. Dopamine release will happen with whatever ways you think. And of course, it will create the inhibitive changes in the eyes and ultimately due to the myopia correction. Oxidative stress needs to be reduced with so many other factors also, but red light therapy definitely gives that effect. And of course, you can use a traditional methods combined with red light therapy, combined with ortho-K, combined with diet, atropine, so many things. So there are a lot of research coming up. You can keep yourself updated with that research and clinical trials and decide what you want to do. So definitely it will slow down the myopia, reduce elongation, and more effective than just a simple spectacle. So try and add this red light therapy by whatever means. Of course, there are limited evidence and long-term effects are still not known. So it is a non-invasive, easy to use and synergistic effect. It has a limited evidence as of now. Cost still we don't know, and time commitment is required from the patient's point of view. So use the therapy and it will definitely work. There is a placebo effect also. So one has to standard. Everybody right now has a different way of treating myopia. Pediatric ophthalmologists has their own set of standardization. General ophthalmologists have different ways. Different eye care practitioners, optometrists has different ways of doing it. But basically, you have to come up with this standardization, and using the combined therapy. And I'm sure one day there will be standard approach to the myopia control, and we will be able to help our future generation, that is our children's, to have a good and healthy lifestyle and a normal house. These are my references. I'm open to questions. Thank you so much.
Good evening,
Huge.
sir.
Yeah, please go ahead, Dr. Mahit.
Sir, I have a doubt.
Yes,
This market is full of this blue light filter glasses where they market it so much. What is your take on that, sir?
it's a marketing gimmick in
Mhm.
one line. See,
Okay.
the filter is used especially for the people who are on the computer for a long time. Okay, so but all the devices which are approved,
Mm.
including your television or laptop or mobile screen, has a limited UV light and which is not harmful. UV light is also important. It is useful for the eyes. In fact, that's why we are asking our children to go in sunlight, right? But the
Yes, sir.
time is important. The time is important.
Okay.
When you use
Actually,
the
I
UV
read
light in the
somewhere.
night, then your
Mm.
dopamine will keep on producing. See, just now during my talk,
Mm.
I said dopamine, increase dopamine, that will control myopia. But in the evening, you don't want dopamine, you want melatonin to sleep.
Yes, sir. Yes, sir. Actually, I read somewhere that blue light filter glasses actually they cause myopia because that melatonin cycle is altered.
Disturb, yes.
Disturbed. So, because most of the parents come and ask us, should I bluntly say that don't buy, they're not good? Can I give a blanket statement like that, or should I?
Sure, sure,
Okay.
sure, why not?
Okay.
See, you're
Okay.
the doctor, you know what it is. See, that's why we are having all these conferences, all these interaction, we are exchanging our knowledge. So
Mm.
blue light, it is proven beyond doubt that it makes, see the a simple spectacle glass will cut off the blue light. Do you know that?
Yes, sir. Yes, sir.
So,
Mm.
so why do you need extra blue light to make more money? Simple. But see, I'm not against. Yes, they can make more money, no problem. There are anti-reflective glasses. There are so many other, advantages. Thinner glasses, high refractive index. Everything is useful. But if they
Mm.
ask your opinion as an expert,
Mm.
well, it is not going to cause any problem. But
Mm.
you see my presentation, I am saying no to myopia, no
Mm.
single vision glass to myopic children.
Mm.
No,
Mm.
specialty
Mm.
glass, like a
Mm.
bifocal glasses. They're
Mm.
expensive, but it
Mm.
is helping. It is helping.
Mm.
See, they're all international glasses. That's why they're expensive. That's why I
Mm.
also come up with a little cheaper variety. But try
Okay.
to do something which will, try and control.
Mm.
That's why see,
Oh.
atropine is becoming so popular. It is
Mm.
proven.
Yes, sir.
Only
Yes,
problem
sir.
is you are stopping it in between, and
Mm.
again it is rebounding. So there will be some new methods will come whereby it will continue and the patient will get long term effect.
Okay. Okay. So as of now, my counseling will be like just having a blue light filter glasses without any power gives a false sense of security. Why do you want to have it and increase your screen time? I don't want to give a false security to your child. First, reduce the screen time. That is how my counseling is going now.
Perfect. See, actually, during my counseling, I said sunrise to sunset. That is
Mm.
the time they have to do whatever reading, writing, playing, everything. After
Mm.
sunset, no close work, which is
Mm.
difficult. But there are
Okay.
people, so put your work into the screen, mirror, use your mobile phone, and all televisions have the smart televisions
Mm.
now. So you can mirror that on the screen and see the distance. If you increase more than 24 inches,
Mm.
you are safe.
Mm.
But
Mm.
at
Okay.
24 inches, you can do work or read, right? So you
Yes.
enlarge it on the screen and do it. There are ways
Okay.
and means. Put more lights in your rooms. Most of the time people will have only one that LED light. Put
Mm.
four
Mm.
lights.
Okay.
In fact,
Okay.
that white LED light, I hate it because
Okay.
again, it's a UV light.
Okay. Mm.
So these are small things. And
Mm.
if you can measure the lumens, has the in your room, the lumens has to be more than 5,000.
Okay. Okay. Thank you, sir.
I think Dr. Jethani can give his opinion on the optical stimulus and the atropine stimulus. I think you may have covered it in other lecture series, but both has a uh, definitive, impact. And if you can combine the optical stimulus with the pharmaceutical, stimulus, you will get a perfect myopia control.
So I have a question.
Yes.
I think there is lot of evidence. Yeah, I will just comment on this and then we'll move on to the second question. I think there is a lot of evidence now uh, talking about the fact that combination therapy works better than monotherapy. So combination therapy is definitely something which is in thing. We can go for question. I can comment later. Not a problem. Please go ahead.
So how effective is the red light therapy if we compare it to the traditional methods? And is
Yeah.
it safe to be used in younger children? Like what is the
Oh, definitely, definitely. That's why we are talking, and that's why Dr. Jetan has put 1 hour on this red light therapy. See, again, let me remind you, if you are using the Chinese instrument gadgets, which has that laser lights, then it is you are asking for trouble.
Yes.
But general red light therapy with the LED light, simple LED lights, it works. As I said, if you want, I can send you a link of that, research scientist in UK. A simple LED, red light LED is showing a lot of, good results. Of course, there are a lot of new devices. In fact, we are also trying to come up with some device which will be easily available and safe to use by children. But as of now, you can prescribe red glasses. You can have other ways and means of red lights. See, we are using red light for amblyopia treatment in vision therapy, so it is safe.
How do you, sir? I just wanted to ask how effective it is as compared to the traditional methods. Like we're using most of the time the combination therapies. So if how much is it effective?
So tell me what combination therapy you are using right now?
Low dose
Atropine
atropine
and
and depoprostenol.
spectacles, right? So along with that, now see all the defocus glasses which are available in the market, they are saying about 60 to 63% myopia control,
Yes.
right? When you add atropine, it exceeds to about 80 to 90% now. So it is good. Now, all those defocus glasses which are available in the market are little expensive. So what you can do is you can switch over to red light glasses with a regular. See, this is not proven, okay?
Yes.
But this red light is definitely helping, and it is a natural, source. If you can use what I do is I prescribe a red light spectacle with a full correction, and ask them to wear outdoors at least for 2 to 3 hours from morning till afternoon. See, the melatonin, the dopamine effect will happen during first first half of the day. That is about by 1 o'clock or so. So all the myopia control will happen from morning when the child gets up till the 12 o'clock or 1 o'clock. After that, the body goes into different cycle. So if you can use it during that first half, it will definitely work. So you can use, I know the red light, I'm wearing red light. I don't care because, I'm at a different level, but children's may not be as confident to wear red light, red glasses in the school. But they can use it when they are playing or during, outdoor activities or anything. And just like sunglasses, and they will have the same effect.
So is it that they have to wear it regularly every day? Because most of the times it is possible that they can wear it on weekends. Because since that will be time off school. So will it help if they use it intermittently?
So what happened is when I was studying and doing my research and all, if you use, if you want to use intermittently, then there has to be extra light to stimulate that mitochondria. But if you're using a regular daylight and just use a red filter, then you have to use like a 6 days a week, at least 3 days a week or more. It's like exercise, minimum 3 to 4 days a week. If you do, then only you'll get a good result. If you use only once in a week, only on Sundays, I'm going to go my exercise and gym, it's not going to help. It's a false security.
Yes, sir.
Minimum 3 to 4 days, or, as I said, limit it to morning 2 hours, like a therapy, 2 to 3 hours.
Thank you, sir.
Thank you, Dr.
I think there are some questions on chat. The
Mhm.
first question is by Sham. Does a red refraction coating on spectacle lenses provides the same therapeutic effect as red light therapy for myopia control?
So that is what I was talking about. Use that red filter. I'm not talking about anti-reflection coating. I'm talking about a red filter, which I'm using, something like that. That can be used during the morning hours. See, you want extra light to go in the eye. Then only it will get stimulus. Otherwise, it's just a fashion. And that is why the LED lights, which will cause extra. If you're during one of the presentation, you saw electron, the photon light is important, not the voltage, not the intensity. It is the photons, how many photons are going in the eye. So that will stimulate the mitochondria and create, that it's these all the effects that you get. So yes, you can use a red light filter glasses and ask them to use, especially in the morning to afternoon.
Sir,
Okay,
any
so-
device?
We are
Yes,
working.
Dr. Chawan,
We are
keep
working
going,
on
keep
it.
going. No,
Since you are a research guy, so we are expecting something from you.
We have the device, but right now we are doing animal studies, which is very promising. But the
Okay.
data, the number of animals is less still. So we are just waiting to accumulate correct data and then we'll publish that. But it is coming up soon. See, what we are
Because
trying to do is trying to adjust my treatment or devices to the economy of India. Because Indian population in general is poor. So if you just give them something which is exorbitantly priced, it is not going to be widely accepted. We want it to be widely used. We are we was 1/3 population, and looking at that data, if it is going to be 50% of our population myopic, which is so much of burden on our health system.
actually, and sir, any kind of lights to be, red LED lights used in the rooms for kids?
If you see my clinic, yes, there are a lot of red lights.
Yeah, that is what I.
Because then patient will ask, hey, why you are using this many red lights? I said, I have to grow my hair. It works on hair, okay. But that question, the stimulus comes from the patient. When they ask you, then they are ready to accept. If you start conversation, they are not interested. But looking at the red light, in your room, they will ask, and then you can convert them, hey, this is helpful and this is useful. Right now, we don't know the dosage. See, it is useful in dermatology beyond doubt. They know exactly how much to give and all. And skin is forgiving. So even if there is a little burn, it will forgive. But for the eyes, no, once you cause any damage to the retina, gone. So that's why we are cautious about it. And once the correct, analyzed data comes out, after animal studies, we'll be doing a human trials and then we'll release it. But yes, your short answer to your question is yes, put some red light in your room and stimulate the exchange, and then you can give the simplest red glasses. See, red glass to be used in the morning, regular, they can use any other glasses. But I would say best way to do is multifocal soft contact lenses, which is not available in India, but orthokeratology. It is available in India and gives fantastic control. On that, if you want more control, like we are using a dual therapy, now you can use triple therapy or use a red light along with that for 2-3 hours, and you will get a perfect myopia control.
Okay. Yeah. Thank you, sir. How exactly do you use red lights in your clinics? I mean, just to.
So I have this red light array that you get from Amazon, and it has a choice visible red light and infrared. So switch off the infrared, use a visible red light, and use it. Usually I put it on my head wherever I'm sitting. It is on the ceiling. So definitely they will ask what is happening and all. Or when I wear this type of red glasses, they will. So this starts the discussion, and then I give the links to all the different scientific papers, let them decide what they are entering into, and then you handhold along with their ortho-K, along with their atropine treatment, along with whatever they are doing right now, use the red light therapy. As I said, simple spectacle is available easily, and I ask them to use 2-3 hours when they are going from home to school. most of the schools are now half an hour, 1 hour away from the home. So that time they can wear as a sunglass. Other people are using brown or red or nothing. They can wear these glasses, red glasses with a prescription, no problem.
Okay. Right now you are sitting your US clinic or India clinic?
I'm in India right now.
All right. All right.
Yeah.
Thank you, sir.
I'll be
I
here
thought
till next 2
if it is
months.
there, we might just visit and see what exactly are you using.
No, I'll share a picture.
Yeah, sir, please.
Yeah.
Thank you, sir.
Sir,
Yeah.
sir, what are the indications and contraindications for ortho-K lenses, sir?
So myopia management. Okay, I have given ortho-K lenses for myopia management. That means to get rid of myopia, we have lasers and other things. I'm talking in general myopia, not myopia control as such. Okay, so ortho-K has been amazing. Those people who are using ortho-K lenses are really happy. They don't want to go for LASIK or anything because it's a reversible and it is guaranteed proven method. It doesn't cause any problems. Of course, you have to be careful with the sterility, as I said. So contraindication, keratoconus, any high irregularities on the cornea, environmental factors, non-compliance with the sterility aspect. So those patients you have to be careful. Rest of the time, your regular myopia correction, I give. So I have a presbyopia clinic in US. So whoever patient walks in, if they're above 55, we offer them a IOL exchange, clear lens exchange. I work with Dr. Rajesh Khanna, who's a wonderful celebrity ophthalmologist there. So we get all high-end. We have practice in Beverly Hills also. So clear exchange is what is given, and the way we tell them is, oh, you will never get a cataract in your whole life because we are remote the lens only. But when they are not ready for that, then we give a multifocal soft lens. Now, multifocal soft lens has to be worn during the day, and most of these patients have a dry eyes. So that is where we give the ortho-K lens with a presbyopic correction in the center. So in the 2 millimeter, I create a little wall there. So you get a little defect there. And that is what the plus power in 2 millimeters on the centrally. And patient get distance and near vision perfectly fine. If so, people who are about 22 or thinner corneas don't want to go for LASIK surgery for whatever reason, they are the best for ortho-K. And the children whom I have fitted for ortho-K for myopia control, now they don't want to go for spectacles or any other thing. I ask them, okay, now you're 22, 23, we can stop for 3 months and then we can do the LASIK surgery. But most of the people want to continue with ortho-K. Some people, okay, now I'm fed up with this, I don't want. So they stop for 3 months, the cornea comes back to normal and you can operate. So depend on the patient choice, you can modify. And children's, I have seen, like I have given a lens to 4-month-old child. Sorry, 4-year-old, not 4 months, 4-year-old child. Why? Because the parents were already aware of what is happening. Both of them were minus 12. And the husband was in the ophthalmic industry. He was selling rape of IOL, and so he was well versed off and well aware of the things. So we fitted him, and they took good care and good control. Amazing control. Of course, we had to add atropine at later stage, but yes.
Sir, and what is the longest follow-up with you for the ortho-K lenses, sir?
Oh, I have about 20 years of follow-up now.
Oh, okay,
Yeah,
okay.
yeah, 84
So,
I started.
have you ever seen any complications related to that, sir?
See, when patient, many times, especially high myopia, -5 above, sometimes they will come and complain, hey, now it is not working. I can't see clearly. My vision is gone. So I need to replace the lenses. So instead of replacing the lenses, simple thing, there are a lot of protein depositions happen in that reverse zone. And that is what that effect is not happening. So just do some protein enzyme removal cleaning. Wow, it is working fine. So those are the complications. I embed them, I force them to make sure that no infection, no RGP solutions to be used. They can use it, but for storage, they have to use hydrogen peroxide. No, alternative. So for India, I came up with this, hydrogen peroxide. You can use a off-the-shelf hydrogen peroxide. Now, the problem with off-the-shelf hydrogen peroxide is that hydrogen peroxide has an inhibitor. There is an extra chemical to not to neutralize it faster. So after neutralization with the catalyst that I mentioned, the hydrogen peroxide will become water, oxygen will release, but that little bit of chemical will remain. So that can be cleaned with the normal saline and your RGP cleaners, and then put it in the eyes. So that will save a lot of maintenance cost, but no substitute for hydrogen peroxide. They have to use. Otherwise, I don't want my patients to come and after when they are going to blame you. Even if it is their problem, they'll come and, hey, you gave me the lens and I got the infection. So, and many times, see, in my practice, as I said, I practice half of the time I'm in the US. So if something this happens, infection can happen, and they will go to any other ophthalmologist who's not aware of orthocare. Most of the ophthalmologists are biased about orthocare. I said, don't use this. This is what is going to happen. So the patient will get, discouraged. But fortunately, all these patients, they are so addicted to seeing clearly without glasses, they will follow what I'm saying, and they will again go back to orthogonal lenses. It's really
So,
amazing.
as per my understanding, you told that even for presbyopes, you are giving this ortho-K
Yes.
lenses with central correction, sir.
Yes. So
So,
you
you
have
are
two
using
ways.
them right now in India also.
Correct. Yes. So two ways. As presbyopic contact lenses, you give one monofocal, that is one eye for distance, one eye for near. That is the simplest way. But if you give a central, divot, you get a bifocal effect, and patient really love it, because in adult myopia control we give 6.7 optical zone, and in that central 2 mm for the near works amazingly. Of course, you have to select your patient. It's like you can't put EDOF lenses in every cataract patient, right? So you decide what patient is good. So for that, you can give a simple multifocal soft lens for trial for a week or so. Just give us a free trial, and once they enjoy that, spectacle free vision for distance and near, then you give orthocal, because orthocal lenses are a little expensive. But once they are convinced, they'll go for it. See, not every patient will go for it, but people who want that cosmetic correction, see, now when you have a myopic glasses, like you're stuck with it. You can't wear Ray-Ban or Gucci or any other sunglasses or anything. But those people who want to wear sunglasses, they have a lot of outdoor activities and all, they definitely want a, spectacle free or correction free vision. That's why people go for LASIK surgery, right? Why LASIK has become popular? Nobody wants to wear glasses, apart from, marriage benefits and other things. But yes, ortho-K is safe and reversible. Only thing is, in LASIK, you spend once. In ortho-K, every 3 years, 4 years, 5 years, they have to keep on spending to replace the lenses. In USA, when we do,
So
we
that's
offer a
question I wanted
myopia.
to ask, sir.
Yeah. Let me just complete this. So in USA, we
Yes.
offer something called global therapy. That is, every year they come to us and we change their lenses. We charge the same $3,600 for every year. And during that year, if they lose the lens, break the lens, anything happens, we replace the lenses. Okay. In India, that doesn't work. In India, they can wear it as long as they want. The moment their power is changed more than 0.75, we change the lenses. So 3 years to 5 years, we replace the lenses. Yeah, go ahead. You have questions.
So you mean to say usually ortho-K lenses need to be maybe changed maybe in a period of around 3 to 5 years, depending on the change in the refraction, sir?
Yeah. Change in the refraction, change in the quality of surface, protein deposits, scratches. It's a reverse geometry RGP lens. So even RGP lens will have warpage and other things also. So all those things has to be considered. But Indian population, we want more and more. They continue using the same lens for 5, 7 years. I have patient wearing for 5 years, 7 years also. But of course, the patient was intelligent, so he got new pair. But he always says that if something goes wrong, like as I said, protein deposition, so he can't use that new lens. So he put it in the hydrogen peroxide and the protein removal, and then he goes back to his old lens, 7-year-old lens, and he still enjoys clear vision with that. So it works.
Okay, sir. Thank you.
But I don't tell them to wear it continuously more than 3 years. I will tell them 2 to 3 years. India, 2 to 3 years, you may have to change.
So how can we
Sir,
incorporate ortho practice with your help?
Sir, simple. You just K1, K2, refraction, HVID, and topography. If you send it to me, I can get the lens made in US and ship it to you. Of course, my lens is a little expensive than what is available in India. I think I've given you the Preeti's number. If you want, I can give you. Dr. Jethani will have her number. So you can use her services. They are a little cheaper. But if it is something complicated, something more advanced, like -9 or -10 or something, then whatever. Means I'm trying to bring a little cheaper version in India also. See, what happens is it costs me about $120 for every pair to import. Plus, if it gets stuck in customs, then again 26 to 36% custom duty. So that's why the cost increases. But
Dr.
that is
Kalyan,
the.
he makes lenses for Lady Gaga. Don't go into all that. He's
No,
a,
no.
he's a big guy. So we
No.
can,
See, sir.
Doctor Saab, it is difficult to get the lenses. See, I have prescribed lenses, but with Dr. Chavan, and the lenses work fine. They are expensive. अभी तो सर थोड़ा डाउनप्ले कर रहे हैं. तो we will contact Dr. Preeti only. And
Yeah, whosoever. I mean, I know he's
no.
he
So what
cannot.
I'm trying to tell is, what I'm trying to tell is that if there is a patient you feel that he needs ortho-K and is a difficult patient and everybody has refused him कि इसका ortho-K नहीं हो सकता है, तो Dr. Chandrasekhar is the right.
Yes, and I'll be happy to help you design or anything. No extra charge or anything. We are all colleagues, so no problem. But as Dr. Jetani said, use the Preeti services. She's fine. In fact, the lab is next door to me in my California lab. So good lenses, no problem. If you have any problems with those, or when you have a high myopia, high astigmatism, then you will need my services, and then I'll be happy to help. No problem. Yes, and Dr. Jetani said, I make those jewelry and diamond and all the special effect lenses for movies. So yes, my services are a little expensive, but it is available. No problem.
Thank you,
No,
sir.
they are worth gold. Nothing like that. I mean, they are worth gold. Your services are worth gold. There's no doubt about it.
Thank you.
sir, one last question out of the box. Just a presbyopia patient, nothing else, in metro for distance. Can we give ortho-care if they want?
He will never enjoy that.
No, sir. I have an ophthalmologist colleague, a senior, who doesn't want to wear near vision glasses. So,
yes,
can they use ortho-K?
Is he using a multifocal soft lens for presbyopia?
Not
No.
yet. They are into 1.5 currently managing, sir.
See, I'll tell you my personal thing. I don't have any correction for distance. It took me 10 years to use multifocal lenses, a spectacle. 10 years. I'll get distortion, these, that, because I never worn glasses. Myopic patient are used to that distortion, everything, brain is used to it. So when you add bifocal, not a big deal. But for people who have never used glasses and now suddenly they want for near, very difficult.
Okay.
Theoretically, yes, you can give. Okay, I have given a multifocal scleral lens to the top-notch refractive surgeon of India, because he has one eye multifocal IOL and other don't have cataract yet. So it's difficult. So for that, I have given him. See, I offered him ortho-K. No. I don't want to touch. Don't touch my cornea. So I'm going away from the cornea, offering a multifocal scleral lens. You can use multifocal scleral lens also. So whenever he wants to use binocular vision, he wears only one eye multifocal lens and operates.
Okay.
But in your case, the ophthalmologist has both eye near correction, right? So start with multifocal soft lens. Give him that. Ask him to wear it for a month. If he yes, he is enjoying that, happy, then switch off. See what happens is when you wear a bifocal, you are getting all the rays are focused. So the intensity of that light entering in the eye is more sharp and precise. When you use a multifocal lens, you are cutting off those photons into distant area. So brightness will be compromised.
Okay.
Ophthalmologist, he is definitely intelligent, so he will not be liking it. If you give it to a man, that is a different story.
Okay.
In my experience, so many, first of all, no ophthalmologists want to use orthopy in their eyes. I have so many patients. Scleral lens, yes, they understand, okay, this is fine. Don't touch my cornea.
Okay.
Look at Dr. Jethani.
Okay.
He is putting contact lenses and in so many patients, but he is wearing high myop glasses.
Sir Jethani sir, what is your take on that, sir?
No, glasses are fine. We are not bothered about glasses. We have always worn glasses. What is wrong in wearing glasses? Myopia control is not about removing glasses. It is about controlling the myopia progression to prevent any complications.
नहीं सर उस टाइम में था नहीं ना कंट्रोल इसलिए इतने ग्लास लग गए नहीं तो
that's fine. That's fine.
See, but there are see now difference. I'll tell you so many ophthalmologists, you will see they don't wear any glasses. But if you go close, you'll see they are wearing contact lens. Because patient asks, see, Dr. Jethani is not a LASIK surgeon, so he can afford to wear glasses. But you go to any LASIK surgeon or refractive surgeon, they can't afford to wear high myopic glasses because patients are going to ask, you are not doing it yourself and you are asking me to do it. Well, just for a curiosity, they will definitely ask. And you'll see a lot of people wearing soft contact multifocal soft lenses. It's a practice management thing.
So,
okay. Thank you, sir.
So let us call it a day. I know it will go on and on because once you have a pioneer in hand, it is going to be constant back and forth questions and answers. So I will just call it a day, and Dr. Chavan is just a phone call away. I will share the details
email or
on
WhatsApp, no problem.
Yeah. True. So thank you so much, sir. And it was really nice. You not only covered it well, the advice and the opinion is truly worth gold. So thank you so much for joining us, and we'll take leave. Thank you. Thank you,
Thank
sir.
you so much. Thank you so much. If you have any questions, anything, just email me or WhatsApp me. I'll be happy to be part of it. Thank you so much.
I will share the details of Dr. Chavan.
Yes. Thank you so much.
Thank you so much.
Thank you, sir.